Hello! Is your heart okay? Or are you having a problem? In this video, we will talk about 5 signs that appear in your body that may indicate that your heart is not 100%. We know that cardiovascular disease is the #1 cause of death in the world, so stay tuned. Let's go! What are the 5 signs you should watch out for? Which could be showing us that you have a heart problem. What are the signs you can see? First sign, frank sign. I'm sure that from today onwards, you will start looking at people's ears more carefully. I'm sure about that. Why? Because there is a little sign in the ear that could indicate that the person has some blockage in the heart, coronary or carotid arteries. Seriously, this is true. Back in the 70s, Dr. Sanders Frank noticed that many of his patients who had angina, which is pain in the chest, they had a diagonal crease on the ear, and he described that sign as Frank's sign. Second sign, persistent cough with white or pink phlegm, meaning you have fluid in your lungs or alveoli. It's important that you don't let that cough go. Look for a doctor. Third sign, shortness of breath when you go to bed. The person starts to add more pillows to see if they sleep better, and as time goes by, she is unable to lie down. She has to sleep in a chair. You may also wake up choking during the night, which is called paroxysmal nocturnal dyspnea. This speaks volumes in favor of the heart problem. Fourth sign, generalized weakness, feeling to read all the time, and difficulty in everyday activities such as shopping, climbing stairs, carrying groceries, walking, combing hair. This is because the heart cannot pump enough blood to meet the needs of the body's muscles and tissues. Fifth sign, chest pain. If you are having chest pain, the first thing you have to think about is that it is a heart problem. You cannot think that it is muscular, that it is gases, or something simpler. Could it be? He can. But you always have to exclude the most serious thing. Heart pain is pain or discomfort in the chest that lasts more than a few minutes. It can come and go. It can be like pressure, weight, tightness, or burning. It can radiate to the left arm, neck, back, jaw, stomach, for the elbows. There may or may not be sweating, pallor, associated nausea, associated dizziness. If you have these symptoms, you should see a doctor as soon as possible. And now, how to prevent yourself. How can you prevent yourself from having a heart problem? Do physical exercises. Get out of the chair. Do not stop. Physical activity is extremely important for your circulation in general, for your heart, for your physical and mental well-being. Also, low-impact exercises such as walking, cycling, swimming can improve flow caused by chronic blockages in the veins and arteries. If you smoke, stop smoking. Smoking is one of the worst things you can do for your health. It causes impotence, inflames all your arteries, forms fatty plaques, increasing your chance of having a heart attack and stroke, and also dementia. If you are overweight or obese, lose weight. Excess weight increases your blood pressure, worsens your blood sugar, inflames. It overloads the kidneys, the heart, the joints, the venous system, increases your risk of thrombosis, and increases the fat in your liver. Eat healthy foods, lots of fruits, vegetables, fiber, whole grains, olive oil, and little red meat, and processed foods. If you feel something like I just said, see a doctor, explain it to him, and follow his instructions. Did you like the video? Remember to share so that more people have this knowledge.